Okay, so I'm going to give you guys kind of a summary video from the articles I've been posting in the last couple weeks. People were asking about what they can actually do to help their gymnasts with their hip mobility. So I'm going to walk you through a series of things that I would probably do with somebody who has tight hips in the front, aka her. So she would do this before practice every day to kind of get warmed up. So we're going to start from the first article. I talked about breathing, and then work our way all the way up through the articles I just talked about today, related to like hips and posterior chain stuff. So the first thing I have them do every day before practice is knees on the wall, hip width apart. She puts one hand here and one hand on her stomach, and she just takes deep breaths and trying to focus on this moving. Right, we talked about calming down their central nervous system and shifting them to a parasympathetic state, not all jacked up and sympathetic. Just to kind of ramp down their system and kind of get a global tone release, hopefully. And then what we want to do is for a couple. They can also work on lifting their hips up a little bit, putting their arms over their head, right there. So like right here, so she gets a little bit of core engagement, and then also she can lengthen her lats, keep her ribs down. So just like you go in for 4 seconds, hold it for 4 seconds, and then breathe out slow through pursed lips, which is like that for 4 seconds. So she'll do a whole bunch of those. And what I'll have her do right after that, she's going to grab a lacrosse ball and she's going to start rolling out the front of her hips. So right along the top of the quad up here. Best way to do it is just kind of lay down. Top of your rectus femoris is your quad muscle in there. You can get, some of your TFL is a hip flexor right on the inside. Some of your groin tissue up high on the inside also goes in there. So you just want to roll the whole front and get a little bit of tone release, just very light. It doesn't have to hurt at all. You shouldn't be mashing on it so hard that you feel like it's really uncomfortable. We're really just chasing neurological changes and not so much true tissue changes. So she'll just do that for 30 seconds to a minute. Usually we'll do both sides, but she's just going to do this one. And then we talked about how your quads and some of your groin tissue can be involved. So she's just going to roll up and down on here. So this is all just releasing tissue that's probably tonic or tight or overused. That might be pulling them into an anterior tilt. So we want to release all the tissue first before we really go into any activation or try to pull them out. And a good thing to look at for this is Dr. Perry Nicholson. He goes through this whole rail system, which is what we created our program off of, with some other things, the ramp program too. So this is kind of just getting things to calm down a little bit in the front. And then we're going to go into the next series of drills that are about activating the other side and trying to use muscles on the other side of the joint to pull it back out so that we don't have to change that just are short-lived. We're releasing her hip and her quad and her groin and the tight tissue in the front that's restricted. We want to immediately follow that up with sorts of work on like her glutes and her extending and the opposite side of the joint along with her core to kind of integrate it all together. So what we do is one of my favorite ones is to grab this. So I would be like a beam or a bar base, but we're in practice, so I'm just going to have her grab these. So she'll start with 2 legs at the same time. She'll pull down on the band and worry about a neutral spine, push her hips to the ceiling, and then take a deep breath. And then she'll come back up. And then she'll pull down, and then she'll lift her hips, and then she'll go back down. So we're going to try to get her obliques to fire and her glutes to help rotate her pelvis backwards and not push her in an anterior tilt. And then if it's too easy for her, she can do a single leg bridge. So she goes down, lifts her hips to the ceiling. And then she'll be trying to feel most of it in their glute, and then trying to feel a good core brace, continue to breathe. We're going to integrate all that new mobility we just used a little bit just to get activation on the other side. So she'll do a handful of these, and then directly after this, I like to put them into an actual hip stretch. So have her come up on half kneeling. And so she's gonna, this is a really important thing with this is that when they come up into it, it's very easy for gymnasts to just want to sink into their hip capsule and they're, not really good at true tissue. So if she just leans forward like most gymnasts do, you'll just kind of get this and it feels like, she's stretching, but unfortunately she's getting more of her hip capsule. So what we do is like a true hip flexor stretch or like try to get a little bit of core activation. So put your foot, hands go on the front knee. I got this from Charlie Weingroff, who's a stud when it comes to this kind of stuff. So belly button comes in, she squeezes nice and tight here. She pushes down on her leg to get that same core activation, so she's nice and round, she's tight here. And squeezing this allows for more hip mobility. She leans forward with the straight until she feels a hip stretch and stop. Right there. So that's where she really feels it. That's her true hip length. And I think many times that we don't really get true accurate measurements of how hip flexor mobility is because they're just cheating into their capsule or their lower back. So she's going to come back, she's going to go push down her leg, tighten up here, come forward. When she gets to that point, she'll just breathe in deep. So just like breathe in and just try to relax, try to sink into her actual hip tissue rather than just cheating. Go back and forth. She does 2 or 3 of these. And then after this, she releases a little bit more. So another just core drill to put it all together. It's just a half kneeling lift. So she's gonna, I would act as a bar. This can go around the bar base, but do the same type of stuff. So same thing, set it up right, core comes in. So we're using all the hip mobility she's been working on, right, with all these drills, but now we're trying to get it to work into a movement pattern or try to get to a high level dynamic stability drill. So we put it all together into one piece. So we've released it, we've activated it with the hip bridge, We're going to integrate it into some of these half kneeling lifts and things like that. And then from here, we're going to try to do actual gymnastic skills. So whatever we would need to work on. So you can do 4 or 5 of these, and then after this, maybe we would do, you know, needle kicks, or we would do back handstrings, or split leaps, or tap swings, whatever is like giving them the problem with their tightness in their hips. But we've gone through this progress of releasing it all the way from like a breathing situation to the hip mobility itself, activated the other side, use the core to build it in, and then now we'll go and do whatever we're doing in practice. So from here, you can go wherever you want, whatever they're tight on, but that's just a little bit to help you guys out.